Okay, in this section we're going to talk about how prisms are used to diagnose and to treat a patient. So here is a light ray that's traveling along, and if we put in front of the light ray a prism, we're familiar with the fact that the direction of the light ray will change, that where it was supposed to go straight ahead, because of the prism the direction has now changed and it's off by this angle here. And if we have a thicker prism, then it will influence the light more and change the angle to a greater extent. And we can actually quantify, give numbers to this. This is less critical for a medical student to understand, but it's very important for someone in the field of strabismus to do measurements with. That we know that this prism is thicker and more strong than this prism. And what we can do is, if we want to determine the strength of a prism, we measure at 1 meter how much, we measure how much the light ray has moved by, where should it have been and how far over has it moved. And in this case it's moved over by 10 centimeters, and so that would be the measurement, the units of the prism would be called a 10 prism diopter prism. Whereas in this case, this prism is a 20 prism diopter, because what it does is by the time the light ray has got to 1 meter, it has moved 20 centimeters from where it should be. So let's just see an example here with this video of how prisms work. So here we're starting in our example with a relatively strong prism of 30 prism diopters, and that means that at a distance of 1 meter the image will have shifted by 30 centimeters. And in this video, keep your eye on the computer monitor in the background and watch how it shifts as the prism is put in front of it. Okay, so we can see the prism, there's the apex, and the image will always shift to the apex. So keep your eye on the monitor and look at how it's shifted over now. And if we use a smaller prism, this is a 10 prism diopter, the monitor will shift, the image will shift, but to a smaller extent, which makes sense. And of course, any way that we point the prism, the image will shift there. So in this case, if we point it upward, then we can shift the image upward. We can also shift it diagonally if we need to. And strabismus experts work with a prism bar that has multiple prisms of different strengths in it. And you can see that as you run the prism bar over the patient's eye, that the image will progressively shift to the side. So let's just take an example now, again, a patient who has strabismus. So we said that in this case, the eyes would be okay in this particular example, but that if, again, looking from above, the left eye was misaligned, that the patient will now have a problem of seeing double. And we want to try to quantify that. So what we could do is we could take a prism and put it in front of the left eye, and see what happens. And now the light ray will, through the prism, be shifted over, and that shifting causes the image in the brain to shift, and we see that it's moved but not enough here. So we give them a stronger prism, and in this case we see that it now brings the eyes into alignment, or brings the images into alignment, and the person sees single. So the clinician who's examining them would be able to say not only that there's a misalignment, but they would be able to quantify it and say that there's a misalignment of 20 prism diopters. This is not only helpful in terms of making the diagnosis and the assessment, but it can also be very helpful in terms of treatment. So for example, if I wanted to help this person with glasses, I could ask an optician to prepare glasses for the patient that have 20 prism diopters in it, and when the patient puts those glasses on, they should see single. So prisms are not only helpful, again, for assessing the patient, but they can be very helpful in terms of actually treating patients as well. And we'll discuss that a little bit more on the section of the lecture that deals with treatment.